There are lots of ways that patients can actually pay for a sleep appliance. Obviously, a majority of them rely on medical insurance. There's financing, and then there's out of pocket. You can have in-house financing plans, lots of different ways. But how do you actually get a patient to pay cash upfront for an appliance? And we have worked with a lot of dental offices who provide dental sleep medicine. And one of the things that we noticed was a trend amongst the offices that were closing, 3-4 cases a week with cash patients, which is almost unheard of, was that the doctor was going above and beyond to provide value to the patient. And I'm going to give you 2 examples, and they both involve a phone call. Number one is actually following up with the patients who inquire about oral appliance therapy with your office. Those patients do not expect a phone call from the doctor themselves. So when they receive a phone call or a voicemail from you, the actual provider, they're flabbergasted because doctors don't call patients. It's something very rare. It's something of value. It's something perceived as valuable. So what triggers in that patient's mind is the law of reciprocity. And the law of reciprocity states essentially that if someone receives something of value, they feel inclined to return that value. So if I come and mow your lawn, you feel obligated to come and mow my lawn. It's a very interesting thought process in the human mind, but they perceive that phone call, you taking time out of your day to call them and just say, hey, I noticed you requested a consultation with me. I wanted to check in with you and see about getting you on my schedule because this is a serious condition. And I want to see if we have an opportunity to help you as quickly as possible. It's like, wow, the doctor called. I got to call them back. And that actually translates further down in your workflow because they've experienced that value. They're actually more likely to move forward with the next step. Let's say they haven't had a sleep test and they need to get a home sleep test. They're actually more likely to move forward with the next step, not just scheduling the consultation, but even subsequent steps after that because of the level of value they experienced on the front end. Additionally, what you can do, another phone call opportunity that you have as the provider to add value and get people more likely to move forward with treatment, even if their insurance doesn't cover the cost of it completely, is through a phone call one day prior to the patient's consultation. And it's a very open-ended conversation. You're thinking, Todd, there's no way I have the time to do something like that with all our patients. Let me get into this because I think it's going to change your mind. Now, what you do is you call the patient 24 hours before their consultation and you frame the conversation. They answer the phone, say, hi, this is Dr. Smith. I have about 3 minutes. I wanted to call before your consultation tomorrow and see if you had any questions for me. Now, what you've done here is you're like, wow, the patient feels like they're in complete control of the conversation because you just asked a very open-ended question. But what you've done is you've framed that conversation. You said, I have 3 minutes. I have 3 minutes. Do you have any questions? The patient feels incredibly valued, but you've also protected your time in the presentation of that question. And the patient is so grateful. And again, they're going to be more likely to show up for their consultation. They're going to be more likely to move forward with a sleep test. They're going to be more likely to pay out of pocket if their insurance does not cover it or their deductible is very high. So go ahead, try both of those things and start to see the shift of how many cases you're closing, even on insurance patient, but mostly see how many more cash patients you're going to be closing. It's going to be exciting.